Okay, let me explain today all the high yield points related with niacin. So, role of niacin in our body, it is all there in the form of NAD. NAD is nicotinamide adenine dinucleotide. So, this nicotinamide adenine dinucleotide, it is coming from niacin in our body, and niacin is vitamin B3. How do you get niacin? So we get niacin from animal source and plant source. Both the sources are good source for niacin, and also need to remember that unrefined grains and cereals, generally they are rich in niacin. One of the point that you need to remember in terms of food source is corn. Corn has got something called as niacin, which is a kind of inactive form of niacin, and it is not its bioavailability is less, so digestion of niacin is less. That leads to deficiency of niacin in people whose staple diet is corn. Okay. Now, what is the function of niacin in our body? So the function of niacin, it lies in NAD function. Now the NADs are of two types: NADH plus H plus, NADPH plus H plus. So the NADH plus H plus, any dehydrogenases that uses NADH plus H plus, they all are participating in catabolic reaction, catabolism. Catabolism uses NADH plus H plus, whereas the anabolic reactions, dehydrogenases participating in anabolic reactions, they need NADPH plus H plus, like fatty acid synthesis, cholesterol biosynthesis, and bile acid synthesis, that kind of enzyme. So we have hundreds and hundreds of enzymes in our body which needs NADH plus H plus or NADPH plus H plus. That's the function of niacin in our body. Now let's move on to see, and also we can synthesize niacin in our body. This is one of the water soluble vitamin where we can synthesize, and we synthesize niacin from tryptophan, amino acid tryptophan. 60 mg of tryptophan can give rise to 1 mg of niacin. Now let's move on to see deficiency causes for deficiency of niacin. Niacin deficiency can be because of dietary deficiency, like people who are eating corn as their staple diet, that can give rise to niacin deficiency in them. Other causes for niacin deficiency, especially in the developed world, is chronic alcoholism. Alcohol decreases the absorption of niacin in the intestine, leading to niacin deficiency. Or it can be because of Hartnup disease. Hartnup disease is an autosomal recessive condition where there will be a defect in the absorption of tryptophan in the intestine, and then the defect in the reabsorption of tryptophan in the renal tubular cells, overall leading to niacin deficiency, because tryptophan deficiency will lead to niacin deficiency. Now the Carcinoid Syndrome, another cause for niacin deficiency. Carcinoid Syndrome is because of neuroendocrine tumors that are there in the intestine. There will be proliferation of these neuroendocrine cells leading to tumor. What they do is they are going to divert tryptophan into serotonin. Majority of tryptophan is diverted into serotonin. Less is available for niacin formation. That will lead to niacin deficiency. What is the disease that you get in niacin deficiency? Name of the disorder is pellagra. Now what are the signs and symptoms you see in pellagra? So early signs and symptoms are very non-specific, like generalized weakness, muscle weakness, tiredness, not able to work properly, that kind of things, so which are very vague, so you won't be able to diagnose niacin deficiency there. Later signs and symptoms, it can be divided into 3 Ds. That is diarrhea, so where the enterocytes are affected, so the patient will have frequent motion. That's one of the major signs that you see in niacin deficiency. Next is dermatitis. Dermatitis where the skin is involved here, so especially the skin that is exposed to sunlight is affected here, so where there will be hyperpigmentation of the skin, scaly lesions are there with the thick plate-like skin can be seen, so which is sometimes referred as Cazel's necklace or the poor man's necklace around the nape of the neck. And then the dementia, neurological signs can be seen in niacin deficiency where there will be memory loss, or it can be associated with other neurological signs along with the dementia. So these are all the 3 Ds that you see in pellagra, and that is diarrhea, dermatitis and dementia. Treatment is niacin supplementation has to be given. So the niacin supplementation is not provided in time, or the diagnosis is not done in time, so it can progress to 4th D, and that is death. So this is all the high yield points about niacin deficiency and the disorder that is pellagra. I hope this short video helped you to understand all about niacin. Thanks for watching.